this is Dr. Kyle with ICE, bringing you your next segment in Ask the Doc. So what I wanted to address today revolves around the upper cervical spine. I think this is a really good chart to maybe cue you guys into. This upper cervical spine in today's world is compromised because of what we call anterior head carriage. You've heard me talk about this many times before. It's essentially, it's not so much this, it's more that your head comes in front of your shoulders. So the problem with this is when your head goes forward, you flex your lower neck, but then you kind of hyperextend your upper neck. So you're more or less jamming this upper neck. And this can be a really big issue because it's got a lot of action going on around from a neurologic perspective. This is where your brain meets up with your spinal cord, and your spinal cord branches off with a lot of these peripheral nerves and what we call recurrent nerves, meaning they come back to which they've came, they go up into your head. So a simple head position and postural distortion can really cause us a lot of neurologic issues, not just up here, that potentially could also go downwind. So I'm going to give you a quick little tip to make sure this is not you as you go throughout your day when you're on your phone, your computer, driving, all that jazz. Because I can tell you, my patients can tell you, this kind of makes me cringe when I see people like this walking around out in public. So just when you happen to catch yourself doing this, a real easy thing to think of is your tongue position. Your tongue neurologically will stimulate to your brain where your head is in space. And so for most people that have anterior head carriage, they're pushing their tongue forward. That tongue is, if you feel on yourself in a rested posture, if it's up against your front teeth, it tells you that everything is kind of just protruding forward slightly. So to help negate this, what you should do is have your tongue on the roof of your mouth when you're in a resting position. This will help keep your head kind of more over the shoulder blades and might even help you feel a little more natural. So if you're someone that happens to be in a position where you catch yourself doing this position a lot, or just because of technology or your job, this simple little tip, put your tongue on the roof of your mouth, could make a huge difference. Hopefully this helps some of you watching out there. Again, my name is Dr. Kyle with ICE. Thanks for watching.